In order for fertilisation to take place, the egg needs to be fertilised by the sperm. So if there's a problem with the egg, this simply won't happen. Now, the types of problems that can affect egg production are numerous, but I think we need to remember a key point which differs to men. Women are born with all of their eggs, so as we get older, the egg count simply drops, and at the age of 40, this rapidly declines, which will affect your fertility. Whereas men, for example, their sperm is constantly regenerated. Ovulation simply means an egg is released from your ovary waiting for fertilisation, so waiting for a sperm to meet the egg. If you're having irregular periods or no periods at all, it may be a sign that something is wrong. The most common conditions are polycystic ovaries, endometriosis, and sometimes even just genetic conditions can affect the ovulation. There are a number of conditions that may affect sperm count. Sperm need to be able to swim, so anything that distorts the tail of the sperm will mean that fertilisation cannot occur. There are lots of conditions that can affect sperm count. The most common probably are sexually transmitted infections such as chlamydia and infections such as mumps, which is why it's really important to vaccinate your children. Well, another great reason to vaccinate your children with MMR, but that's a whole nother topic. Medications can also affect the sperm count, so I really would suggest trying to see your GP as soon as possible to go through medications that you're on and whether there are alternatives that may improve your sperm count. As you may recall, I've explained that the egg needs to be fertilised by the sperm. Now, if the route is obstructed between the egg and the sperm, then that in itself will cause problems with fertility, despite the fact that there's an egg and despite the fact that there's a very mobile sperm. The most common, especially in Afro-Caribbean community, is fibroids. Fibroids are non-cancerous lesions or tumours that build up inside the womb, and they can be really big, and they will affect the passage of the sperm to the egg, and also will affect where the implantation of the fertilised egg will be, simply meaning that you won't be able to conceive. There are lots of treatments for this, so I advise seeing your GP if you suspect you have fibroids. Fibroids have a number of symptoms, mainly heavy and painful periods, so I would recommend, again, seeing your GP if you have these symptoms. In some circumstances, the womb may be misshapen. Women would have no periods, and often these women are aware that they have this condition. It's the GP's job to try and identify where the problem may lie. We would need to ask you some questions about whether you've been pregnant before or fathered any children, as this will really help. We also need to ask detailed questions about your sexual history. It's important that you try and feel as comfortable as possible, even though the questions may seem intimate, but we just simply need to know your risks and whether there's a cause for what's happening. Blood tests are also very useful, and these would normally include hormones, both for the man and the woman, and also sexually transmitted infections such as chlamydia, gonorrhea, HIV and hepatitis. For women, a scan may be offered, and that's to simply look at the womb and the ovaries to see if there's any conditions such as fibroids or polycystic ovaries. Men will need to have a sperm analysis test. That's a really detailed look at the sperm to check the count, to check the motility of the sperm, as well as the shape and size of the sperm. IVF, in vitro fertilisation. This is the process where the egg and sperm, multiple sperm, are placed in a test tube or in a lab, and they allow fertilisation to occur naturally. When this happens, the baby fetus or the fertilised egg is placed back into the woman, and the woman harbours the egg and the sperm until a baby is created. Now, normally with IVF, they will place 2 of these back into the womb. Now, the criteria for IVF varies from borough to borough, so it's really important that you check the criteria, as it can be quite strict. ICSI, intracytoplasmic sperm injection. This is a process where one single sperm is injected directly into the egg and fertilised. This fertilised egg is now placed back into the woman, and she carries on with a normal pregnancy. This is normally ideal if there is a problem with the motility of the sperm or the count of the sperm. Sperm donation. This is essentially just that. Sperm is donated and artificially inseminated into the woman. This is a good option for same-sex couples. I recommend going to a good clinic with a good reputation to ensure the rigorous health checks have been done to ensure a good sample of sperm. Adoption. This is an option for many couples, and I just don't think it should be ruled out. There are lots of agencies that have good reputations that may be able to help you. Thank you for watching. I'm Dr. Danso. For more information, you can find me on Facebook, Instagram and Twitter. Tune in next week for more.